have a 68-year-old female, and she's in a vegetative state after suffering traumatic brain injury in an automobile accident. Even though she received very good nursing care and frequent turning, she developed a stage 4 pressure ulcer on her coccyx. There are 4 stages of pressure ulcers, which increase in severity respectively. The first is stage 1, where there's redness and heat. Stage 2 is partial thickness wound. Stage 3 is partial to full thickness. What we're dealing with is stage 4, which is full thickness to muscle and possibly exposed bone. Pressure ulcers are caused by a prolonged lack of oxygen to the skin. Those most prone to pressure ulcers are the immobile elderly, those unable to reposition themselves in bed, those with less subcutaneous fat, people with decreased vascularity of the skin, those who are incontinent of urine and feces, that can cause skin breakdown much more quickly. Also, people who take medication that can cause thinning of the skin, blood flow issues, or those with conditions like diabetes, which cause decreased feeling in the extremities. What we'd like to talk about now is prevention. Some of the things we can do to prevent ulcers is to turn more frequently, every 2 hours. Check often for presence of feces and urine, and clean and dry the patient immediately upon discovering wet or bedding. Also, use a compression mattress to decrease circulation. Passive range of motion helps to increase circulation. Also, it's important to take care not to shear the skin when turning or repositioning. We should keep the patient well hydrated. Do frequent skin assessments, taking notice of bony prominences.
Check your elbows.
Some examples are the sacral elbows, knees, heels, sacral area. It's also important to provide nutritional supplementation to maintain skin health. Moving along, we'll discuss treatment of stage 4 ulcers. So our student nurse will now gather supplies in preparation for caring for the wound. She will introduce herself and identify the client.
Hi, I'm Amy. I'm a student nurse, and I'm going to go ahead and address your wounds today. Can you give me your name and date of birth?
She'll tell them what she's going to do.
I'm going to go ahead and change your dressing.
Ask their pain level.
Can you tell me what your pain is on a scale of 1 to 10?
Provide pain meds and wait a half hour before beginning dressing change.
I will go ahead and give you your pain meds, and I'll be back in half an hour to do that dressing.
Next step is to wash your hands. Make sure you've maintained privacy.
Pull the curtain.
Explain what you're going to do next.
So the first thing I'm going to do is I'm going to go ahead and measure how deep your tunneling is.
Put on your gloves.
And I noticed that, how are you feeling now? We did, I noticed that we gave you, I looked at your cloth, and I checked your chart, I saw that you were given.
Next, you're going to inspect and measure the site, as well as if there's any tunneling. The skin around the wound, and the patient. And you also want to note the patient's response to care. After you've done that, Remove gloves and wash your hands. Our student nurse has opened a sterile field with instruments and gloves, taking care to maintain sterility. She will now pour sterile saline on gauze pads in a sterile bowl. Next, she will don her sterile gloves.
And it did not. With her little drawings on the board and permeability, she still does that. She has a big problem and she has drawings on the board and stuff. And she's understanding. She does a drawing.
Very nice. On the dressings, open them up and pack the wound with them, starting with the tunnels. Be sure to count how many gauze you're packing into the tunnels.
Okay, so what I'm going to do to start off is I'm going to clean your wound.
No, it shouldn't hurt at all. So I'm gonna go ahead and open, all of these are open.
After you have done that, you cover with dry gauze. There we go. Next step, cover with AVD pad, which is extra absorbent pad. And then you can go ahead and remove your sterile gloves. Next, you would initial date and time, a tape on the tape of the new dressing, and then replace it on the dressing to hold it on.
We're gonna use the Abbott gauze and
Place it, get the other one, place it. Oh, it's the same one. And now I'm going to put on the APD pad. And we just put that on top. And at this time, I can take my gloves off.
which I would dispose of properly.
And take my tape.
Next, you will wash your
How do
hands,
you feel? Is that okay? All right, I'm going to put
remove tools and supplies, and chart how the patient tolerated the treatment.
Are you feeling okay after I did the dressing change?
Thank you, and that concludes our presentation on dressing a stage 4 pressure ulcer.